everybody, hope you have a smile on your face. This is the dental review guy, Dr. Varun Acharya. Today we want to talk about the type of handpiece system or the type of air rotor or air motor system which you should be using in your dental chair to make life easy. So a lot of students and people who have recently started their practice ask me, what should we invest in a dental chair? They talk about fancy upholstery and other fancy benefits from the chair, and I think very importantly in the chair, don't look so much on the quality of the leather or the color of the chair as much as the handpiece itself, because that's your main workhorse. So there are two types of handpiece. Now the most traditionally known handpiece is the air rotor handpiece, which, let's take a look here. This is an air rotor handpiece. It's a typical air-driven turbine. The compressor generates air, which then uses that to spin the drill on this handpiece. And this goes theoretically at a speed of about 350,000 RPM. But there's a big disadvantage. When you start using this handpiece, when you start cutting with this handpiece, the speed actually reduces and it drops down to around maybe 180,000 to 200,000 RPM. And also there's quite a bit of chatter, so there's a lot of movement because it does not really have high torque. So that's a regular air rotor handpiece. But newer technology is one of these speed increasing handpieces. This is, it's a 1:5. If you look at the base of it, this may be slightly less, 1:4.5 handpiece, and so that's a speed increasing handpiece. This one maximizes at 200,000 RPM, but it's extremely stable. So when you're doing any type of cutting, it really cuts anything like butter. So this really is very useful when we're cutting out old metal crowns or zirconia crowns. This really helps a lot. And I want to demonstrate and show you exactly what I mean when I say it's a lot more efficient than your air rotor handpiece. So this is your typical air rotor handpiece, expected to run at about 300 to 350,000 RPM. So, and here's a chrome cobalt crown which we're going to try and cut. So let's see how this works with your usual air rotor handpiece. As I give pressure, you can see that the air rotor handpiece is slowed down significantly. And so yes, they teach us to sort of go in this paintbrush kind of motion to cut effectively, but this really does take a while. So we're going to keep going. We're going to keep going till we see a perforation, and this might take a while because this is chrome cobalt. So I don't really have the patience to do this, so let's switch to electric handpiece and see what that does for us. So now let's try with the speed increasing electric handpiece. It's mounted with the same metal cutting burr which was used on the air rotor handpiece, and it's the same crown, it's just the other side of the same crown. So let's take a look to see how well this does with chrome cobalt. Okay? Yeah. As you can see, I've already cut through the crown, something which was taking a very long time using the air rotor handpiece is already done with the electric handpiece, and you can see it's been cut right through. So I think from that demonstration it's kind of obvious that the high torque handpiece is much more preferred for me compared to the regular air rotor handpiece. So the brand which I use here, this is a W&H Allegra WE99 LED-G, if you got that. I don't know if it really matters which brand you use. So a couple of things to note is to see whether it has a fiber optic. If you're not using loops with a light, you may want this fiber optic attachment over here. And the other thing to worry about also is the head size itself. This head size shouldn't be too big. If it's too big, you may have a challenge accessing further in the mouth. compared to air rotor handpiece. You can see lengthwise it's a little bit less, but this air rotor handpiece is also labeled as Kevo's Extra Torque 606, and you can see that this is a little bit bigger, but you can get air rotors with much smaller heads. So if you're a periodontist maybe and you're trying to consider a handpiece for your practice, maybe you should look at a simple air rotor with a small head rather than these. But if you're a restorative dentist, then you may want to consider these high torque handpieces, and you should remember that they have a bigger head no matter what you do. They do come out in smaller versions, but never as small as an air rotor handpiece's smallest version, right? Also the weight is a little bit more in this, so that's a disadvantage. So I think any brand which makes this 1:4.5, 1:5 speed increasing handpiece will work for you. You need to make sure that your chair supports this handpiece. So that's before you purchase your chair, you need to find that out if it's possible, or maybe you can even convert your chair to support this handpiece. But that's something which you need to talk to your dealer about. The same attachment, the micromotor attaches the straight handpiece and the contra-angle handpiece as well for all of your trimming and polishing needs. So this doubles up as a multi-purpose attachment, which you may or may not like. It depends on what your preference is. I personally don't find this to be a hindrance. So to conclude, when you're purchasing a new chair, try to make sure that it has an electric handpiece connection, something which supports a high torque, and it usually you're looking for this red band. Of course, this has been autoclaved quite a lot of times here, but this used to be a red band and now it's orange in color, but this is what you're looking for. So make sure it has that, and talk to your dealer to make sure that you have support for that. I hope this whole thing was useful, and until we meet again, this is the Dental Review Guy, Dr. Varun Acharya, signing off with a smile.